I'm Chris Bouneff. I'm Executive Director of the state chapter of the National Alliance on Mental Illness, NAMI, Oregon, and I'm just going to try to rip through what I was going to say. Most of you probably know about NAMI, so I'll spell you that. What I do want to start with is just an observation of my 20 years of doing this. The state hospital and the conversation, do we commit someone, do we not, do we force them to care, do we not, takes an inordinate amount of time and an inordinate amount of money in this state. We have been talking, the same conversation has happened every year for 20 years, my 20 years. These institutions only serve several hundred people at a time. Until we can flip the switch and talk about the tens of thousands of people who need services so they don't become one of these several hundred, we will never get out of this conversation, whether it's aid and assist, civil commitment, PSRB, we will be stuck here watching our general fund dollars going into what is essentially a sinkhole and an albatross around the state's neck. And that's just 20 years of experience doing that. And I know we have to have these conversations. We need institutions to work for people. They need to be safe. But these institutions will fill up and we will have waiting lists out the door until we really focus on the things that keep people out of this level of care. With that said, I do want to focus on the opportunities the state has around civil commitment. This came about, we had a bill, I think it was 2467, that was just focused on civil commitment criteria that was cruising to passage. And for reasons I don't know why, we got stuffed into House Bill 2005, which largely is an omnibus bill doing aid and assist. So sections 1 through 6 of 2005 are what we're talking about today. And that came about, you know, speaking tongue in cheek, because I got sick of telling families on my resource helpline, which NAMI runs, you have two choices with your loved one who's very acute. You can watch them deteriorate, or you can call the police and hope they get arrested. And then they may end up in the state hospital, but just know they're going to be there on aid and assist. So the entirety of that goal of that care is to get someone well enough to prosecute them. And then that's it. They will be back where they started from, and you will watch them deteriorate further. And so we have brought together people to just answer some basic questions. If we are going to force someone into care anyway, can we spare them a criminal record? Can we do it on the civil side where there's an actual healthcare outcome attached to that care? And with that said, that led to that bill, that led to these changes in January. Now, I was going to have a parent with me today to speak her experience since the law changed, so that you can see the challenges we still have and the opportunities we have before us. The chair is indulging me in reading that. This parent fell ill today beyond what a mask would probably do in terms of spreading to her fellows. So thank you for indulging me in this, and then I'll just close real quickly after I read this. So my name is Anita Goulet of Salem. I'm the mother of a 36-year-old son living with serious mental illness. I'm here today because I've spent years trying to get help for my son. However, the last 4 months have been unlike anything I've ever experienced. For more than 120 days, my son has been actively psychotic, much of that time spent in jail rather than a treatment facility. During that time, I have watched every system that was supposed to protect him fail. My son is not a criminal. He's not a bad person. He's a person suffering from a severe mental illness who needs treatment. For more than 4 months, he has remained in a state of active psychosis. During much of that time, he has been incarcerated in solitary confinement. The jail is not a psychiatric hospital. Isolation is not treatment. Yet for more than 120 days, my son has remained psychotic in a correctional setting, while the treatment he desperately needs remains out of reach. He has been observed by corrections staff, mental health professionals, attorneys, judges, and numerous others. His illness is not hidden. It is visible to everyone who interacts with him. Yet despite this, he remains trapped in a system that appears unable to provide the treatment he desperately needs. As his mother, I have filed petitions, made countless phone calls, sent emails, attended hearings, and repeatedly asked for help. What I've learned is that families are often left carrying the burden while agencies point to one another and explain why they cannot act. I've watched, listened, and even pleaded as people who are described as trained civil commitment investigators excuse away dangerous behaviors as not dangerous enough for civil commitment, as if repeatedly running into traffic during rush hour or in the middle of the night while clearly psychotic isn't dangerous, or that repeatedly hitting himself in the head with a metal object while clearly psychotic isn't dangerous. Because without visible blood, I was told it isn't dangerous enough. And the one time he was in the hospital and scheduled for a hearing, the assistant district attorney told me that she was dropping the case because she could not get a doctor to testify to a definitive diagnosis, as if psychosis doesn't exist without a definitive diagnosis. All this has occurred since the new law lowering civil commitment criteria took effect in January. And where is my son today after all of that? In the state hospital on a rapid aid and assist admission because he ended up in jail yet again. Unfortunately, the goal of that care is solely to get him well enough to process him through the criminal justice system. My son has lost nearly everything because of his illness. He has lost his ability to manage his affairs, maintain housing stability, protect his property, preserve relationships, and most importantly, advocate for himself. People with severe mental illness cycle through homelessness, incarceration, emergency rooms, and repeated crises while their conditions continue to worsen. Treatment often comes only after something catastrophic happens. That should not be the standard. We should not accept a system where someone can remain actively psychotic for more than 120 days while agencies do not act. We should not accept a system where jail becomes the default response to severe mental illness. And we should not accept a system where families sounding the alarm are treated as obstacles instead of partners. If more than 120 days of active psychosis, much of it spent in a county jail rather than treatment facility, does not warrant intervention, then I respectfully ask, what does? Today, I ask you to help ensure that other families do not have to endure what ours has endured. Thank you. So you can see the challenge before us isn't the law. The law, we have a good law. This state has a good, it's no longer the law. The challenge before us is undoing a culture that has built up over several decades, that we can't do anything, that we shouldn't do anything, that we shouldn't collaborate together. And there needs to be a sense of urgency because the resources that are coming online, those SRTF beds and this new capacity and 45% growth, that is quickly being consumed by aid and assist. So we are in a race against time. If we do not transition some of the aid and assist population to civil population, pretty soon we will not have community resources left for people in the long-term acute care system. And it's going to take everyone who touches any part of this business collaborating and cooperating. And these are silos that are not used to doing that. And what am I talking about? Well, I'm talking about OHA, the counties, and civil commitment investigators. I'm talking about the judiciary. I'm talking about emergency rooms in hospitals. I'm talking about district attorneys. I'm talking about all these places that sit in their own area and point fingers at other places. And that's a long tradition in behavioral health. And that happened this week by coincidence. We have the 3 DAs in the most populous counties in this state held a press conference on Monday blaming other people. And 2 of those DAs have direct oversight over representing the state in civil commitment. 1 DA could go and ask his county commission, hey, give me that ability. And instead of Monday pointing fingers, they could point fingers, like we all do it. I do it all the time. But also then be entrepreneurial enough to come forward and say, you know what, we're going to work in our counties, we're going to take advantage of this new law, and here's what we're going to do. And I don't bring them to pick just on them, because all these systems need to do that. We need to do something cooperatively and collaboratively with common purpose. And these sectors are not used to working towards common purpose. And so what I close with is I think the legislature has an opportunity. You passed a good law. Help us bring together, and the chair Reynolds did, we've had a meeting with a number of these sectors. So the dialogue has started. It's going to be a challenging dialogue because we're not used to talking with each other. But if we're really going to race against this time and win that race, that's what needs to happen. And I think that is a proper role for the legislature, to help us as different silos really come together and collaborate in a way that is unprecedented in the state. Thank you.